Hey, hello everyone. Nicholas Hall, founder of Graham's Foundation. I'm here with Ally Kayton. Hey, Ally.
Hi, Nicholas. How are ya?
Oh, I'm doing fantastic. So, if this is not, this may be audio only. So if it is, and people aren't on video, they can't see. Ally has more acronyms, more letters behind her name than in her name. I'm going to give you a chance to introduce yourself, and you can help explain what all of those, because I know they're hard earned. I mean, I know you don't just like you didn't just go legally say I'm going to make my name to Ally Kayton, RMHDMP, APR, blah, 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 102. So at one time I had a lot of acronyms behind my names. So I know that also means a lot of continuing education and things of that nature. So Allie, again, welcome. And if you wouldn't mind introducing yourself to our listeners, that would be great.
Thank you so much. First of all, thank you for having me today. I'm
Of
really
course.
honored to be here to talk to you, Nicholas. We've built, I think, a nice relationship over the last several months, and I'm
Yeah.
really excited to be part of the Graham's Foundation and this conversation with you. So the letters behind my name. Well, I'm a neonatal nurse practitioner. I started off as a nurse in 1999. I've been only in the NICU. I love the NICU, it's my heart and soul. I
Mm.
went back and became a nurse practitioner in 2005 and have been in that role since. And I got my doctorate because I love research and I've been published. And one of my publications for my DMP project was on hypoxic ischemic encephalopathy and the
And
use of
that
the
is in layman's terms, that
uh,
is
basically a brain injury,
gotcha.
potential
Uh-huh.
brain injury for a
Yeah.
baby.
Yep.
And then I felt very strongly committed to working with families in the NICU and wanted to do some like coaching and things like that to support and do that. And what I realized was it was more the need for therapy
Mm.
and to not necessarily traditional therapy. I do a lot of breath work and meditation and yoga
Yep.
therapy with my parents to reset the nervous system, which is
Yeah.
completely out of whack when they
Yeah.
experience a birth trauma or
Yeah.
NICU stay and all the things that can come after that. So that's kind of me. I have three kids of my
Uh,
own. I'm a grandma of two and three puppies and a bird, if you hear it in the background.
yes. Yes. Yeah. So a lot of professional experience and personal and pragmatic experience as well.
Yes.
Um, my gosh, there's so many things that we could talk about where to begin. So you mentioned so one thing that you talked about, you mentioned the word like traditional. I think and I think in explaining your therapy and therapeutic and I continue to see this merging of kind of quote Western and English and some things, you need to you get a licensure for. Some things you can't technically get a licensure for, but are incredibly powerful and impactful as well. And you know from firsthand experience of having been at the bedside with parents in the neonatal intensive care unit. Yes, technically, the baby is the patient as far as the hospital is concerned,
Yeah.
but the parents, especially if they're there like I was for a long period of time, um, you really kind of become the patient as well, or a conduit, right? Or a
Yeah.
real channel for what
Abs-
you're,
Absolutely.
just like you
Yep.
said, you would get calls when
And I put on
you,
my do not disturb on my
and it
phone.
does,
There
and
you go.
they're gonna
Yeah.
find you no matter
Yeah.
what. They're gonna
Yep.
get
Yep.
through.
Exactly. Exactly.
So maybe if you wouldn't mind sharing kind of just a bit more about your evolution from, a neonatal nurse back in 1999 and sort of what you have witnessed over that period of time, especially as it relates to um, the care and support of parents and the recognition of the impact that the journey in the NICU and also with as you recognize with your practice, the transition home. I think there's so much conversation of the time in the neonatal intensive care unit, but I always say that's four walls and a roof,
Hmm.
and parents go to a new four walls and a roof that can be incredibly isolating and overwhelming as well.
Definitely. Yes. I mean, first of all, the NICU is near and dear to my heart in a way. It's like part of who I am because I've been doing this for so long. And I've also seen an evolution of the change over time, how medicine has changed over time, and the access or not access to care and to support and all the things. And when you're in the NICU, as a clinician, I see things from a little bit of a different perspective about what the parents need or what they may be going through. And I'll be very transparent. A lot of parents are like, oh, this is like the troubled parents or the problem parents and things like that. And I have to remind people that when a parent is either showing frustration or acting out or whatever's happening to them, it's because they have all this pent up energy within
Mm,
themselves and they have a lack of control of the whole situation.
yeah,
And they're giving up this care of their precious baby to all of us and
yeah,
to trust us in doing, what we do best. And I always feel that that's when a parent needs the most support,
yeah,
when they're going through this like feeling of being out of control and wanting to care for their baby and not being able to, or not having, a lot of parents can't hold their babies for weeks at a time.
yeah,
And I couldn't imagine. And I'm in
yeah,
it. And I couldn't
yeah,
imagine. Like, it brings tears to my eyes all the time. The first time I see a family, a mom or a dad or kangaroo carrying their baby for the first time, it's
yeah,
profound. And I feel that in my experience, I've just felt that caring not only for the baby but caring for the parents is,
mm,
it's just an extension of what we do as clinicians. And when I became a therapist, I already was doing, you mentioned, Western and Eastern medicine kind of merging.
yeah,
I've been doing meditation and breath work and yoga for almost probably a little over 20 years. And I feel that's how I was able to take care of myself physically and emotionally with what I experienced in the NICU. So I feel that when I say not doing traditional like mental health counseling,
yeah,
it's incorporating breath work and incorporating movement and yoga and meditation to recenter who you are during a chaos. That's the best way
yeah.
that I can describe that. So that's kind of how I bring that into my practice when I'm working with parents or a mom or a dad, however that looks. And I teach them and give them tools when they're feeling overwhelmed, if their baby's still in the NICU or transitioning to home, how to just walk away and breathe. Take
Mm.
those nice deep
Yeah,
breaths.
I remember when I remember how difficult it was to come back to the NICU after our son Graham had passed and our daughter was were still alive and is still alive, but she, coming back to the same place, like literally the next day. And we had considered moving her to another NICU. And as I look back, so we were probably the pain in the butt parents at that time for sure. Part of it was just being able to go to a different building,
Yeah.
just not having to go back to, 'cause we had to go back literally because it was an open bay. So we had to go back to the same exact spot. Um, and so and nobody, nobody talked to us about that.
Yeah.
I mean, we talked to them about, and probably was some conversation of, oh, will insurance cover, is it necessary? I mean, there was a whole lot of logistics, and we ultimately, and I know we had conversations with the staff where Reese was, but and my memory is always it's fuzzy from yesterday, let alone 20 years ago.
Yeah.
But I think I'd actually be able to feel if someone sat down and said, "We understand
Yeah.
how
Yeah.
difficult this must be." and I have like no reverberations of anything like that. And that's a unique situation, but that feeling of overwhelm and is not unique. I
No,
don't think so. No,
not at all.
not at all.
Not at all. In the NICU, it's overwhelming as a just to be there,
Yeah,
let alone to understand all the dynamics of what goes on every day. And I think a
yeah.
lot of that, like, oh, go ahead. I'm sorry.
I'm curious as I think about it. Again, this is perspective outside of that time in the NICU and um, neonatal therapists, of which you are have a specialized relationship with the patient. Is that fair to say?
I
Versus
think so.
versus the nurse that is has a nurse is assigned, these are your three babies for your shift. Neonatal therapists are going to more float and cover based on what the needs are of the babies. Is that
Yes, I mean, we have a psychologist in our unit because I don't work in our unit as a therapist. I work as a nurse practitioner. And
okay?
we have an amazing therapist in our unit, but she's only one person.
And
And
there are 1,000 level 3, 4 NICUs in the US.
yes,
Most of them do not. Most of them do not.
they do not have a therapist in their
Sure.
NICU. That is
Yeah.
very true. Social workers are there, obviously, to help with all the discharge coordination, planning, anything that
Yeah, our
needs to
social
happen.
worker had to cover labor and delivery and the
Yeah, we are lucky enough to have dedicated social workers in our NICU because our unit is
yeah,
very, very big. But
yeah,
I, the therapist, like I said, she's amazing in our NICU, and she tries to see everyone if she can. But it's hard when there's like 90 plus
yes.
patients.
And they're
How do you
coming and
do that?
going, and when are they there?
Right, exactly. So we try
Yeah.
to do things in the unit to support the parents as far as like art therapy and we do like little happy hours and stuff for the families, and our psychologist does do that and handle that. And we've tried, like I reached out to you, and this is how we
Yeah.
met about, bringing an organization like the Graham's Foundation into a hospital system to mentor families
Yeah.
with other families who've been through the things. Because we, as clinicians, don't walk in your shoes
Right.
unless obviously we've had our own personal experiences, which a lot of nurses that I work with have had that, which brought them into being a NICU
Right.
nurse,
Yeah.
right? So it's
Yes.
amazing how that comes to like full circle. And one of the nurse practitioners I used to work with became a nurse and then an NP because of her experience with her twins.
Yeah.
So, but we want to be able to support the families in such a way, and we're trying to take care of the patient, which is the baby, but
Right.
also trying to support the families, and we can't do it all, you know.
Where have you seen over the course of your career? Um, as what I've seen is the expectation of intervening to resuscitate a baby is getting earlier. Survival rates are improving, and so as I look at, as a former numbers person, I look at that and I go, well, that means more parents spending a longer period of time in the neonatal intensive care unit.
Yes,
Um, just pure statistics there, pure data.
yeah,
So that means more families having to go through, and we went through the loss of our son, and that's traumatic. And I continue like um, caring for myself from that experience, but didn't bring Graham home, didn't deal with whatever the outcomes from that premature birth may have been. And
right,
so just more families are not are not having to say goodbye. They're having to bring that baby home. And so
right.
I'm curious, what have you seen or witnessed of support for families? Um, over over that period of time. We've got telemedicine. We've got, I mean, there's
Yeah.
been there's been and we went through COVID. So we have a lot
Hmm.
of we have some circumstances
Yeah.
that the industry and the NICU has gone through over that period of time. So I'm just kind of
Right.
curious what you witnessed.
So personally, for me, like we resuscitate babies now at 22 weeks. So it used to be 24, 25 weeks. Now it's
Yeah.
the gestational age is lower. The outcomes depends. I don't statistically it depends. I personally feel like every baby has their own journey,
Yeah.
and what one baby experiences another may not or may. But going home with a baby that is either ventilator dependent or with a G tube or with some type of equipment, oxygen and G tubes, we send babies home now sometimes with that. What support is out there is not that much, not that much. We, I, we have PPAC places, which are like medical daycare for babies that are complicated, have a complicated course, to kind of provide respite care for families, which I think is fantastic. And we need more of those, I think, to support, because we are seeing the younger gestational age being born and cared for and going home with like a ton of complications. So we definitely need more respite care for families. But as far as therapy and counseling and support that way, I think telemedicine has opened up that for families, because
Yeah.
you can't always leave with a baby that has a complicated course at home, and they're already trying to go to all these appointments and how to figure
Right.
out transportation and support. And it's just, I think it's a plethora of things.
Yeah.
And I recall a client I worked with who was just overwhelmed with just figuring out how to schedule appointments. And then you talk about the economics of it all and how that family, one parent may have to stay home and
Yeah.
not be able to go back to work, and or there's a separation of a family because of the stress of
Yeah.
that. So for me as a clinician, I see that side of it, but as a therapist, I want to help to bring that together and give the support so that they have the respite of themselves to be able to understand it's okay to have a cup of tea and go walk away for a few minutes and take a shower. Those are, it sounds so simple, but
Yeah.
even families of full term newborns who are going home without all the complications are struggling with
Yeah.
those things. And I'm not a big fan of social media when it comes to this area of medicine,
Yeah.
because it is throwing families over the edge, I think, with
In
this.
what respect?
I think they're comparing themselves to other
Mhm.
families that are experiencing something similar. Even, like I said, full term, newborns healthy, no issues. I think families are like, I'm not doing this right. Why am I not able to cook dinner tonight? Why am I feeling this way? There's postpartum depression, postpartum psychosis, the baby blues, the feeling of rage and overwhelm. It's just, I could
Yeah.
talk about this all day, but I know we're on a limited
Yeah.
amount of time. But
Yeah.
there's so much, and I feel very passionate and strong about providing that support for families to give them the strength and the empowerment that they need to, go through grief and loss, and support, because it's a grief and loss on so many levels.
Yeah.
And so I really feel very passionate that we need more information, more studies done, more support for these families, to go home and know that they're not alone. It's
Yeah.
very isolating feeling.
Yeah. No, I remember, three different places for the different medications that
Hmm.
we had to get and the different specialists. And that's just sort of for a lot of families, it's just if everything's going okay,
Hmm.
there's
Exactly.
multiple appointments,
Yep.
um and that's often not the case. There can be readmittance and then to a PICU and
Hmm.
you name it. Um, I often have said parents should have to opt out of some sort of therapy or support not have to be not have to opt in or have to somehow be recognized because I think we're pretty good at putting up a good face and just trying to kind of, gut through it.
Yeah.
Um, how do you, in terms of supporting families when they come home, um, obviously we're trying to do that at Graham's Foundation from with the mentor program, but we are
Mhm.
not any way, shape, or form not trying to replace or not trying to be therapists. How, I guess, how would a parent know if therapy would be or if some sort of
Mhm.
therapy might be needed or beneficial for them?
I think, first of all, being open to it, because regardless of all the conversations around therapy and around mental health, is that stigma.
Yeah,
So being open to understanding that just because you may feel like you need additional support outside of whatever it is that your family dynamic is,
yeah,
that it's okay to ask for help. It's
yeah,
okay to ask for a mentor through the Graham's Foundation. It's okay that if you're doing okay to give back to your NICU as a mentor or through the Graham's Foundation or any other area that provides that support. Talking with somebody who understands or has an idea of what you've been through
hmm,
is support a lot of times enough for families. But recognizing that it's okay to ask for help because it's going to help not only you, but also
yeah.
ultimately your baby and your family, because it's going to help to heal some of the chaos and the nervous system dysregulation that happens when you're faced with trauma.
Yeah. And I know I probably um I may be a bit be a bit unusual speaking for the male species that I've tended to kind of go into therapies and support, kind of going into it, just being open.
Mm-hmm.
And it's started well before Reese and Graham were born. And so I've kind of continued to lean in. And when things are particularly tumultuous in my life, like recognizing that support. This is there's a learning opportunity here. So there's some sort of growth on the horizon. I don't,
Yeah.
and where can I, if I think about, during my career with athletics, like we have coaches, we have
Mm-hmm.
support.
Yep.
Um, and to think that this is something that we would do on our own, versus having a coach, a support, someone to encourage us. Um, it seems silly when you kind of think about it when you relate it to other areas of our life when we're going through a process, a transition, a growth period. Um,
Yeah, I'm not really sure how that stigma happened of, oh, I can't get help because I have to be so strong and I have to get through this. I do feel like a lot of families kind of just go through the motion, and especially dads. It was funny because when I started my practice, my first client was a dad, which I thought was amazing because it actually surprised me as well. Like, oh my God, here I am, like counseling this amazing dad who was going through such trauma of a new baby that was coming home, that was home. And he was, I learned so much from him in those sessions of what the support that dads need too. It's
yeah,
a lot of times dads, again, being transparent, kind of get pushed a little bit to the wayside because it's all about mom and she's breastfeeding and trying to breastfeed and all these things. But dads sometimes feel just as helpless or,
yeah,
and please correct me if I'm wrong because I still want to learn everything that I can
yeah,
too. But
yeah,
the moms are the ones breastfeeding, the moms are the ones doing most of the things while dad's sometimes working during this time. And it's really, I think, very challenging for a dad to say, you know what, I need my own mentorship with another dad who's been through this. I think that is
Yeah.
just amazingly important for,
Yeah.
it's so important. And to not feel like you're being weak in any way, because men,
Right.
you want to be strong for your wife or your fiance, your girlfriend, your partner, whoever it is. But you also need
Yeah.
strength and support.
Yeah. And fortunately, we do have a few dad mentors at Graham's Foundation, but
Mm-hmm.
oftentimes when I go to uh, industry related events relative to this industry, I'm one
Mm-hmm.
of a couple of dads, right? So
Mm-hmm.
I understand. And I also recognize that given premature birth, the baby hasn't fully developed. And so there is a desire to, with the staff and the mother, like, can the baby eventually breastfeed, or if not, can the mother produce milk?
Mm-hmm.
And kangaroo care and other, I mean, there's a desire to have that baby to continue to develop as if it were still in the womb in some ways, shapes, or forms. And so
Yeah.
I understand um, why there is the focus on the mother, and and yes, it can be particularly challenging for the father to get a sense of what can my role be in this particular environment?
Yeah.
How can I be helpful?
Mm-hmm.
Can I be useful? Um, I wanted to talk about, Allie, you had made some really wonderful efforts to introduce Graham's Foundation to your system where you practice. And, ultimately we were not successful specifically, but it's not, that's not a unique situation. I mean, we at Graham's, we do get recommendations and referrals from a lot of staff at different NICUs around the country, but it really takes something for leadership to kind of acknowledge and recognize and say, yeah, we're gonna recommend Grams or another organization like Grams to our parents. So I'm curious for those parents that are listening that perhaps they would like to volunteer at their NICU, or maybe they represent an organization like Grams, or they're thinking about starting an organization like ours to try and give back. Um, I guess, what have you, in your experience, what did you see as what are some of the challenges to providing support to parents, right? And whether it's internally
Mm-hmm.
within the system or externally for an organization like Grams.
I mean, I think that a lot of bigger units want things in house, like their own programs, which can be challenging because not all NICU families are in the position, or, whether it be just because of their own journey, that they're able to give back their time
Yeah.
in
Yeah.
it within their own NICU, or the NICU was traumatic in and of itself in their own NICU. So I think that there could be some of that, but also in leadership, I think there's a lot of pushback because it, there's a financial component. But an organization like Graham's Foundation, if I recall, everything we talked about was free, pretty much a free service for the
Yeah.
hospital to refer to you. So I don't, I think it's a lot of just like wanting things to be internal, having their own programs, their own things. But given the extent of what goes on in a NICU, especially the bigger ones with all the subspecialties in a level 4 versus a level
Yeah.
3, or so, I think that it's challenging for a unit to bring something like this in because you have to have buy-in from like everyone,
Yeah.
and I think they, again, well, I don't know that I can pass that out, or I don't know that, my mind goes to, but I don't understand why we can't put a piece of paper in a discharge packet, or on the admission you get like your packet,
Right.
why can't this be in the packet? And it's just, I can't wrap my head around it sometimes. Something so simple to me becomes so complicated,
Yeah.
you know.
And the more, when I think about in my past days of in sales and with large uh organizations, the complexity of the sales cycle.
Oh, yeah.
Larger the organization, the more complex. And the fact, and I would say the fact that our services are complementary, that may that may lessen some of the friction, but it doesn't eliminate it.
Not at all.
Free, free is not free. It's like it's still you're offering something. So if you're a neonatal intensive care unit and you want to provide parent mentors, you're like, well, yeah, of course, why not? Well, we're introducing outside and have they gone through the approved training and have we done a background check and have I mean, the
Yeah.
further you go, and it's like it's all great. And then what happens if something goes something goes sideways? And someone's gonna ask that
Yeah,
question.
no, for sure.
And
But I think, to that point, then we have families going to social media looking for information on their own without
that's
a
I mean
program like this.
that's the flip side of it is that for a hospital, it's like, well, okay, and if parents are they're looking for support, they are gonna find it. They're gonna find something. And
Right.
are we better off trying to even help them in their journey of seeking support,
Right. And
right?
reputable support.
Yeah, and being able to provide some input and guidance. And I know with our like we've kind of um, we support any parents that find us, and we know that there could be a nurse or a staff or someone at some of the largest NICUs in the country that will just say, "Yeah, you should check out Graham's Foundation." That said, where we get the most organizational interest is with the smaller neonatal intensive care units where they recognize they're not going to have a family advisory council.
Right.
They're never going to have the kind of infrastructure to be able to provide what an organization like Graham's provides, and yet they know their parents are going to search, try and find something. So just being able to provide a little bit of direction is better than
Yes.
no direction at all.
Yes, I
Is
agree.
is the system where like from what you're seeing is the impact of with I know the COVID period was, now 4 or 5 years ago, but it certainly kind of decimated all volunteer-led efforts. Has that still continued, or do you see that kind of trending back to doing things in person and
Um, I think that it's taken some time for sure. Like our
yeah,
volunteer program just really started ramping up again, having volunteers in the hospital as a whole, not just
yeah,
necessarily the NICU or mother
yeah,
baby or anything like that, but as a whole, having people coming in. And then during COVID, nobody was allowed in.
right,
There was like
right,
nothing, and
right,
there was, we had our in-house people who were already working and whatever, but there was nobody allowed to come in.
yeah,
A lot of times parents, moms were delivering alone
wow,
because one parent had COVID or the mom
yeah,
had COVID or
yeah,
something
that was
happened.
pretty.
It was pretty awful. But now we're starting to see some of those programs kind of ramp up again, like in the last, I would say, year or so, where, you know, we do art therapy and we do like a happy hour and, you know, little things to kind of bring people together, which is
Yeah,
great. I mean, I support all of those things. I know we have like a year-long waiting list for volunteers. So in our hospital to, because everybody wanted to kind of get back into it.
sure.
And
Yeah.
that's just in the hospital as a whole, not
Yeah.
necessarily our
Yeah.
unit. But
Yeah.
I don't see a lot of volunteers in our unit personally, but I think it's needed just, you know, as a whole to have that support. But I do see things starting to kind of evolve a little bit more
Yeah.
now than
Yeah.
before.
It's gonna be interesting. I mean, I continue to say I think unless a NICU has a really large, consistent census, I think they struggle to maintain those in person where it's a specific day and time. Because it's like when is the good time for
Mm-hmm.
parents to get together and that precious time, they'd rather be at the bedside than
Right. So
um,
part of what I've done personally in my hospital is I started a parent support group, and I do it the fourth Wednesday of every month, and I do it via Zoom because I was going and being there, and a lot of the parent we did it both options, you know,
yeah.
like Zoom and in person, and most of the people who came to the group were on the Zoom because they have a newborn and they couldn't get out
Yep.
or they don't
Yep.
want to get out either
Yeah.
because you know, don't want to expose their baby to like
Yeah.
other
Exactly.
things and stuff. So, and it's been more successful that way.
Nice. That's good to hear.
Yeah. So we're not, you know, I would like to see more engagement in it. But again, it
Yeah.
goes back to telling, like, I'm verbalizing, telling all my families that I see, whereas that's not always the case. So, getting the word out there and, you
Yeah.
know, talking about it and talking about checking out your local hospitals. What are they offering? As a
Yeah.
parent, can you start a parent support group within the hospital system that your baby may have been in? Those things are so important, and also what's going on within your community. You know, you can be the one to, you know, if you have that drive and you want to do something to give back to the community, that's
Yeah.
like one of the best things. Like hook up
Yeah.
with your local lactation support groups, let them know that you're
Right.
providing this service for your community. Try to get on the news and talk about it, you know, all
Yeah.
those things to get the word out there that this is a need for sure.
Yeah. Absolutely. Well, I have often said one of the values of being a mentor, in addition to being able to just to be a mentor, is that ability to give back, to be of service, to be able to, yeah, it's a way to make a contribution because plenty of folks not in a position to be able to do it monetarily, but
Yeah,
what's frankly worth way more than the dollar is the person's time and their energy and their
yeah,
commitment, right? It's way more
yeah.
valuable. Can you
And what
share?
comes out of that, oh, just one other thing I
Yeah,
just
yeah,
want to
yeah.
say, what
Please.
comes out of that too, it's support for one another. Because my parent support group, when we were meeting sometimes in person, they would all go out for lunch after. It was
Nice,
great.
nice.
Yeah, so
Can
you
you
have
share with
fun.
us can you share with us a bit more before we wrap up, a little bit more about your practice and that the evolution of that and what your plans, hopes, and dreams are for your practice?
Um, well, my plans are to grow my therapy practice, which is within Florida. I can see patients throughout the state of Florida for like traditional therapy.
Yeah,
And then obviously I incorporate all my breathwork meditation. But if somebody just wanted like yoga therapy or anything like that, I can provide that for anyone, anywhere.
gotcha.
And I don't know if you want me to share the
Yeah,
name, but
yes, please.
it's called Sage and Stone Holistic Counseling, and I'm also in the process of doing some functional medicine and adding like lab work and nutrition into my practice because I feel very strongly that mental health is a component of everything, not
Yeah,
just mental health.
yeah,
It's what you're eating, how you're feeling. It all kind of ties in together. So
yep,
my practice is very encompassing of not just traditional mental health counseling, but nutrition counseling if you need that to help you feel better, because when you're eating a little healthier, you're feeling a little better. And a lot of times, parents
Absolutely.
in the NICU are kind of just shoving in whatever they can grab at the moment,
Right,
but
right.
just helping make better choices and also learning some tools with breath work and meditation to, again, you know, realign your central nervous system from trauma. And that just helps in the long run. So that's really my practice, and I'm very excited and
Mm.
so excited. And my goal is to, even if I help one person, that's amazing for me. But I definitely want to get the word out there.
Oh man, I hope we can find ways to do that because I think a lot of, and as you mentioned, um uh there's the I guess there's the therapy that you're providing that you can provide through the state of Florida, but there is a lot of, again, it's our whole Western medicine
Yeah,
thing,
it's a
and
lot. Yeah.
the quote traditions, like, well, if you want to really go way back to tradition, it's like it is the breath, it's
It
all
is.
that, nutrition,
Yeah,
food, medicine,
exactly.
and and to your point, a lot of parents, especially during that time, we do have a tendency to put our own well-being to the side and say we're gonna get to that, but
Yeah.
we just don't, we don't have time for that. And at some point, we will break.
Yeah, exactly. And
Um,
if I can share, just one quick tool,
yeah,
you
please.
know, um, taking a deep breath in for a count of four, holding for a count of four, and exhaling for a count of four is a quick way to kind of just take a minute doing that for 3 or 4 rounds. And also just taking a nice inhale and then having a longer exhalation when you're
Mhm.
feeling that sense of anxiety and overwhelm in the moment can just reset you.
Yeah, I agree. Part of my regular daily practices. So, well, Allie, I like to wrap up with saying, oh, it sounds like it sounds like the dogs are back.
Yeah, they're back.
Dogs and birds and
Yes. Yes, that's what gives me a lot of joy since my children are grown up. But I have some of my kids are home from, my one son is home from college. So
oh, fun.
got the
Um,
whole house full.
Wonderful. Is there anything that we didn't get a chance to talk about or cover that, whether it's any, final words of advice or suggestions or questions or, just anything that for our parent population, if there's anything that you want to share?
I just want to say that your staff, or your experiences in the hospital, the staff, um, they really have your best interests at heart, and they want to care for you, and they want to see the best outcomes for your families. And we do love all of our parents
Hmm.
wholeheartedly.
Yeah.
But I think my final thoughts are, just remember you're supported. And if you need the help, get the help. And if you want to give back to the community, the Graham's Foundation is a wonderful organization to do that. And, talk to your hospital leadership if you're a clinician and bring in something to give the parents the support they need. So when they go
Yeah,
home, not only NICU, but beyond.
sure. Well, thanks, Sally. Our commitment at Graham, no parent goes through this journey alone. And whatever support looks like to you, as a parent, we encourage you to find that support because there are people and organizations that, that certainly, are here for that.
Yeah.
And it brings no greater joy to our hearts than to be able to give back and make a difference. So, and
Yeah.
thanks, Allie, for all you do as well. Thanks for spending
Yeah.
time with us today.
Thank you for the opportunity. I appreciate it.